know, have you heard of anyone coming up with creative solutions where they're or seen any innovative systems where they're actually starting to create real change to address this from a systemic level?
Yeah, so I think there's a lot in that question. So for me, having an MBA too, I go to my business mind and I think I tend to see a lot in business. What happens right now is people are making these short-term decisions, like reactive decisions, not proactive decisions. So like right now, one of the things that's happening because news or how many patients you can see is one of the ways that healthcare can increase capacity or increase financial means. If we see more patients, we'll make more money and that will be good. The problem is that physicians are any healthcare worker, because all healthcare workers are being impacted by this. Um, they're the mechanism in which you make money, right? That you can get those patients or RVUs. In the short run, if you're just trying to make money to cover deficits, it might seem like a good strategy to then increase that. In the long run, if you're losing people, like there's a mass exodus in healthcare. And I think this is what's really scary. And a lot of people have no idea how many people are exiting the workforce when it comes to healthcare right now. But if you don't have workers, you can't serve patients. So for me, I'm thinking about there could be a lot of potential short term strategies, but I think what we need to be doing is playing the long game. Like, how do we keep people from retiring early? How do we it like also one of the things happening in medicine right now is people that are physicians are not encouraging their kids or people around them to become physicians. So it's like what we want is a healthy culture that drives a workforce. That's not what's happening, and it's not happening to serve these short run needs. I also think there is some responsibility that goes into the general public of understanding how our choices do impact the system that we've been able to depend on very reliably for a long period of time, and that it's not going to always be like that. And so it's like, making healthy lifestyle choices to the extent that we can, taking good care of ourselves when hospitals are full, acknowledging that and maybe making different choices so that, I mean, that's just to me kind of makes sense from a human perspective. Like, I want to know if I go to the hospital, there's going to be a bed for me. But also, I want to have a doctor down the road. I want my mom to have a doctor when she gets sick. So I just think as a community, we can make decisions as also the way that we treat our healthcare professionals, knowing how burned out they are. I think they're getting now a lot of people being very upset as they go in just because the world has changed. So I think there's some community factors. Systematically, though, there are systems outside of how many patients people see that are kind of progressive and systems are using, and they're seeing good impacts from them. So they're seeing happier physicians, they're seeing better patient outcomes. So I think that there are systems that are out there. I think the challenge with that is, I mean, it's like if you've been a system functioning one way for a long time, I've heard of people because I was kind of like, have you heard of these systems? Have you tried them? And some people have said like it's really hard actually if people don't understand what's happening. It's a completely different way of functioning. So I think there's also a time component of like how do you learn to be in this new system? And I imagine it's going to be a big part of healthcare moving forward is kind of figuring out if there is a better system, how do we implement that effectively? And how do we, it's always hard to get people to change, even if the change could be for the